Ladies and gentlemen, friends and families, and health professionals. I am Dr. Mohammed Adil from UK. I am fellow of the Royal College of Surgeons of United Kingdom with 35 years of unblemished medical record, at least 30 years while serving for the health services in UK. I am general surgeon and specialist in colorectal, breast, and laparoscopic surgery. We have been through extremely difficult time for the last 2.5 years during COVID pandemic, which has affected 7.8 billion people across the world with devastating effect on their health, business, economy, and mental health. As a health professional with 35 years of standing, with research-oriented mind, intended to contribute my services to identify the origin of novel SAR Cov virus, its pandemicity, its mode of transmission, pathogenicity, and the way to protect public from its devastating effects. I express my personal viewpoints for a scientific debate with the other health professionals on the social media and some of my videos, which was not liked by my trust, which ended up with my dismissal on 22nd of April 2020, followed by suspension by the General Medical Council for 2 years. And my case was referred to Medical Professional Tribunal, where recently they have suspended me for another 6 months without any justification. I had no clinical or patient-related issue. I had no social, ethical, probity, or health issue whatsoever. As a scientist and health professional of 35 years of standing, I totally believe on my Hippocratic oath, which says, first, do no harm. I also believe on Nuremberg Code, Declaration of Helsinki's, and Declaration of Geneva, which are totally based on medical ethics, which prevent medical professionals and scientists to carry out improper and inappropriate or unsafe procedures as an experiment on the human body without consent. I totally believe on bodily autonomy of every patient. And I believe on full informed consent from my patient before starting any medication or any medical or surgical procedure. I totally believe on the scientific debate between the health professionals and the scientists, with the better outcome beneficial to the patients. And I prefer face-to-face appointment with my patients to explain the medical treatment or any surgical or medical procedure and its outcome and the follow-up, which is a fundamental principle in the treatment of my patients. Living in the democratic country like UK, freedom of speech and expression is a fundamental right of every individual. I encourage freedom of thoughts and opinion, and I believe on freedom of press and publication, beneficial for the society. And I believe on freedom of religion and practice. And I believe freedom of security for any worker at the workplace without any bullying, harassment, or discrimination, regardless of any color, race, religion, or individuality. I believe on equality and justice. On these principles, I stood for the cause of humanity in early 2020 when I was crucified by my trust and General Medical Council with dismissal and suspension. And I am still suspended because of my personal viewpoints on my principles, which allowed me to protect patients and the public rights. Everybody is answerable in this country. I have no choice but to knock the door of the High Court for justice. I'm most grateful to my legal advisors, well-renowned barrister, Mr. Francis Hoare, and PJH Law, Mr. Philip Highland, are contesting my case in the High Court for justice against the General Medical Council cruelty. I need your moral and financial support to contest my case and to pay the expenses for the legal advisors and the High Court. Just giving crowdfunding have created a page for raising funds for me, and I'll be grateful if you continue donating your valuable money for raising the funds to meet up the expenses for seeking justice. I stood for the cause of humanity and on my fundamental principles of health services, and I will continue standing on that. Thank you very much for your kind support and everything.